Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Hafide, welcome back to Healthy Living. Tonight we are talking about matters of the heart palpitations. Express Care's Dr. Jitka Lom is with us in studio, and she's going to take some of our viewer questions now before we find out about how to properly take your pulse. But first, our first question comes from Brandon from Agate. Can heart palpitations accompanied by shortness of breath be something serious?
They sure can. Sometimes the palpitation is because the heartbeat is going too slowly. Then you'll feel very short of breath because you're not getting enough oxygen up to your brain. And another time is if the heartbeat is going very, very quickly, irregular or regular. You know, the normal heart rate for an adult would be, let's say, about 70 beats per minute. And in this situation, they can go up to 140, even 200, over 200 beats per minute. That heart is just going so fast that you're not efficiently delivering oxygen to your body. You can get chest pain, shortness of breath, and definitely need to be seen in the emergency department.
Okay, Tasha from Barragota asks, what are the health risks of experiencing heart palpitations?
Right, so it just depends on whether they're serious or not. And usually in general, I would say if you have the occasional once in a while skip beat or palpitation that does not give you shortness of breath or chest pain or weakness, it's nothing to worry about. But if you're getting it frequently or regularly, then it's something that you really should have investigated because you don't know when it's going to turn into a more dangerous rhythm.
All right, Ken from Jigo asks, a coworker of mine said he has PVC.
Yes.
What is this and is it serious?
Oh, very good. So PVC stands for premature ventricular contraction. So what we have in our normal electrical system of the heart is 4 chambers, and the atria, the 2 on top, contract first, and then the ventricles contract second, and that's a normal pattern, and it needs to be organized for the blood to flow normally through the heart. So sometimes what happens is that the atria squeeze, contract, and then the ventricles should take their time and come on time, and sometimes they come a little bit too soon. They squeeze a little bit too soon, and that's called a premature contraction. And so the person might feel that as a little skip beat or a little bit of a throb in their heart, and most of the time it's not at all dangerous. If people have runs of those, though, it can become dangerous. So if you have 2 or 3 in a row, that's okay. More than that, definitely not okay. So something to check out.
All right, and our last question comes from Mike from Reed. So I ride my bike several miles, a day, and experiencing heart palpitations after, but no other symptoms. Should I be concerned, or is this normal?
Probably not, as long as it comes down to normal within, let's say, a few minutes, and you don't have any chest pain or shortness of, or weakness with it. Probably it's fine, but you might just think of a couple of other things, which is if you're anemic, meaning if your blood count is low, or if you have a thyroid problem, then your heartbeat may have a more difficult time recovering, getting back down to normal. So it's simple to check out with a blood test.
Okay, so we were talking a little bit during the break about how to actually check your pulse, right, and know what's normal and what's not.
Yeah.
And so maybe for our viewers out there, Doc, if you can tell us what you said normal heartbeat for an adult is 70.
Yeah, about 70 beats per minute. If you're an athlete, it'll be lower. You might be a little bit higher if you're excited. But everybody should know how to take their pulse, and all you do, Mindy, is just find your wrist and then feel on your wrist here with 2 fingers very gently, touch your wrist, and feel around till you can feel the heartbeat. You can feel the pulse going through your artery there. And then you look at a clock and you count how many of those beats you feel in 1 minute, and that's your heart rate per minute. And there's another pulse location up here that you can feel around with. Usually people make the mistake of pressing too hard, then they can't feel it, but if you're gentle, you feel it on your wrist, and you'll start getting used to that and feeling that, oh, it's very regular, and when I'm excited, it'll go a little quicker, and when I'm sleeping or resting, it'll be much slower.
Okay,
so check that out.
When should people be worried?
If your heart rate is over 100 and you're doing nothing, just sitting around, that's probably at what we call tachycardia. It's too fast. And if it's below 60 and you're not an athlete, that might also be something to worry about. Okay. So 60 to 100.
All right. Well, I'm thinking mine's pretty normal. I can feel it.
Yeah.
And then one other point that you wanted to mention, we were talking a little bit about the foods or different things that you can take that might cause palpitations.
I thought of alcohol. Yeah, and there's something called a holiday heart where people binge drink on the weekend, and following that, as the alcohol is wearing off, their heart will go into a rapid and sometimes irregular heartbeat. So another reason to tone it down on the alcohol, but something that could be a risk factor for you.
All right, Doc, thanks again. And before you leave, please remind our viewers about the ongoing Valentine's special that you have going on at Express Care.
Well, it's going to be Valentine's soon, and you may be experiencing a palpitation or a heart throb for a good reason. Those are very healthy. And you may want to buy a gift certificate for your loved one. We're offering those at Express Care, and if you do get one, then we'll enter you into a free contest in which you can receive a package of complete facial rejuvenation for about value of $2,500. So enjoy that, and we'll see you soon.
All right, remember you can find Express Care on the second floor of the Agana Shopping Center. Dr. Lom will be back again next week, and we are going to be talking about foodborne illness that includes hepatitis A, food poisoning, salmonella, E. coli, botulism, as well as norovirus. Send us your questions to healthyliving@kuam.com. Your sanitation inspection results are on the way after the break.